Hey babe, what's wrong? Oh, you sound terrible. You want me to come home right now? Just hold on. I'll be right there, okay? I'll be right there. Honey, what's wrong?
I think I'm sick.
What are your symptoms?
My nose been running, my head been aching, my neck, my back. I think it's my neck and my back.
When did you start getting sick?
I think about an hour ago. I think I need to go to the hospital.
Okay, we'll go.
Hey guys! We're back for another fun-filled webisode. We won't be winning the Oscar for that performance. But you get the gist. You know how sometimes those important men in your life can be when they catch a cold.
We hope you tuned into our last episode on feminine hygiene, where we busted some myths.
Got it all in the nooks and crannies, you know.
Check it out on YouTube.
This series is titled Because I Love Him.
Aww.
It's in honor of Valentine's Day because you know a bestie needs love too. It's really inspired by all our women out there, our crazy busy ladies, because we know in our families we tend to be the predominant caregivers. Sometimes we're wife, sister, mom.
Yes, we take care of everyone in addition to trying to take care of ourselves.
Yes.
Oftentimes we as women are the ones who see the first signs, know when things are not quite normal. So we can really help our partners help themselves when it comes to their health. We're going to be talking about some warning signs that men can see that could mean that there's something more serious going on underneath that. So for any of the men in your life, your boos, your dads, your uncles, your brothers, if any of these things come up, make sure to get them checked out.
Absolutely.
The first one that we're going to talk about is blood in the urine, right? If you can see blood with your naked eye in the urine, it means there's a problem.
One of the big ones is a urinary tract infection. And if you watched our last episode, you remember Dr. Gomley telling you that men don't commonly get urinary tract infections. Men have a long pathway between the opening from where they urinate to their bladder. So it's a long way for bacteria to travel, and usually you have plenty of time to kill it before it becomes an issue. You could have a urinary tract infection with symptoms such as burning your urine, having to go frequently. Sometimes you can have fevers or pelvic pain. And now you have blood in your urine. That should be a telltale sign that maybe you have a urinary tract infection, and you most definitely need antibiotics.
Blood in the urine can also be due to a kidney stone. So these are stones that developed inside of your kidney. And when they're inside the kidney, they don't really cause that many symptoms. But once they start making their way out, girl, you better believe it, he will be crying and writhing in pain. He'll be sweating, nauseous, vomiting. He's going to look like he's about to have a baby.
Yes, and I've heard from men describing it, it feels like that. It feels like they're passing a football as they're urinating.
Right. And so as the stone makes its way from the kidney to the bladder, to eventually them urinating it out, it can cause bleeding.
Another important condition to be aware of is if the prostate gets inflamed. What is the prostate, you ask?
What is the prostate?
So it's a very important gland that resides right below the bladder in a male. And it's important for essential components that make up the semen. In prostate inflammation, you can have symptoms such as blood in the urine, pain with ejaculation, pelvic pain, right underneath your scrotum. And that should be a telltale sign something bad is happening.
It's not right. So common causes of prostate inflammation and really infection are bacteria. Just like how you can get a bacteria that causes a urine infection. This can come from your own bacteria, or it can also come from sexual intercourse. So worst case scenario, if your boo or your dad or your brother sees blood in their urine, it's cancer. And cancer can result in any part of the male genital urinary tract. And some risk factors include a family history of cancer. Smoking is always a risk factor for cancer. And then some signs and symptoms other than blood in the urine are weight loss, pain, sweating at night, fatigue, tiredness.
The second point or warning sign is about testicular mass.
There should only be 2 balls.
The point we want to get across is, men, you really need to get to know yourself intimately. And I know that sounds crazy, but just like women have breast exams they do in the shower, men, you need to get to know what's going on down there. That's the only way you're going to know if something's abnormal. The first one will be cysts. And men can have these typically painless and very benign, meaning they have no cancerous potential, usually located in the testicle. They can be filled with sperm with just clear fluid, or they could be filled with blood. Either way, they're very benign, but these are some of the causes of having a testicular mass. Something called varicocele, a very long word just to describe enlargement of the veins within the testicle. And these veins get enlarged, they get hard. We describe them in medicine as a bag of worms, which is how it would feel when touched. They can cause decreased circulation to the testicle and can be a key cause of infertility, which is why it's important to recognize it. Infections play a key role in testicular masses too, specifically in conditions called epididymitis or orchitis. And these two conditions just relate to the epididymal gland, which sits on top of the testicle, or orchitis, which is just inflammation of the testicle in and of itself. Common causes of epididymitis include, but are not limited to, bacterial infections, including sexually transmitted diseases such as chlamydia. Orchitis, or infection of the testicle, is more often caused by viruses, and one that's more notoriously known to cause orchitis is mumps. Testicular torsion is when the blood supply to the testicle, including the blood vessels in the veins, get twisted around themselves and kind of knock off all the blood supply to the testicle. It is a very painful condition. The testicle appears swollen or kind of sideways tilting or even higher than it should be. If you cut off blood supply to the testicle, you have the potential of losing it. So it's a very time-sensitive condition. You want to seek medical attention immediately. Some of you may have had hernias or heard of hernias before, and all it is when part of the intestine pushes through a weakened part of either the abdomen or the groin. Now, if it pushes through the groin and it goes into the testicle, it can make the testicle appear larger. Testicular cancer is usually felt just as a lump in the scrotum area. Sometimes men can experience pain or swelling, but usually it's just a lump. It's very common in young men, mostly in their 20s, so it's not something to be taken lightly. It's one of the most curable forms of cancer. Treatment is usually successful and the risk of dying is very low. The key thing that I always just tell men or even loved ones is that you need to get to know your body, because sometimes the only sign is just the testicle is not quite right. You have this lump that was never there before and just needs to get checked out.
So hair loss can be normal. It can be a normal part of aging, even premature hair loss.
Yeah.
So if your dad lost his hair in his 20s and you start losing your hair in your 20s, it's probably all genetic. Yeah.
But if you don't have that family predisposition or high risk, then you may want to be a little concerned about the reasons you're losing your hair. And it can be many things. Some things as simple as just stress. Not sleeping enough, not eating enough, not resting enough. It could be a sign of ringworm. It could be a sign of thyroid disease, whether high or low. It could be a sign of an autoimmune condition, such as lupus. Or it could be a sign of one of the stages of syphilis. So, if you notice that it's just not quite right, your hair loss, and you have no good genetic reason for it, it's worthwhile getting it checked out.
This warning sign, he's probably going to want to get checked out right away. That's erectile dysfunction. So it's either not being able to get it up or not being able to keep it up. And even though it could be due to some benign causes, like perhaps the medication that he's on, there are some serious stress. There are some other more serious causes for erectile dysfunction. So one of them is actually heart disease. So the nether regions for the guys are supplied by blood, and if blood can't flow there because of high cholesterol or what we call atherosclerotic disease, and the manhood can't get the blood flow, it's not going to work properly.
Honestly, guys, if ever there's a time when you should give up cigarettes, that's probably the time.
Some other causes of erectile dysfunction include kidney disease, neurologic diseases. So just like how the manhood is supplied by blood, it's also controlled by nerves.
Absolutely.
So if you have something like MS or any other disease that damages the nerves, it's not going to work properly. Diabetes is another one that can cause erectile dysfunction. Those high blood sugars affect both the blood vessels and the nerves, so it's a double whammy.
Commonly in the clinic, I'll have men come in and say, "Doctor, I need the blue pill." And I'm looking at their chart and I'm like, "Well, your sugars are 400 and your blood pressure is 160. I think we have a few other things to get under control first."
Yes.
You'll be really surprised just by getting your health under control and your chronic medical conditions under control, how much of a difference it can make without you even needing a blue pill.
Yeah.
However, if you get evaluated by a doctor and we ruled out everything else and you do require the blue pill, the most important thing for you to know is not to take nitrite medications with that. So it's important you go to the ER, you let them know that you took the medication so they know not to give you the nitrite medication.
Yes.
It can be a very lethal combination.
So ladies, I'm sure some of us have had the experience where our partners have a little bit too much to drink, and then when it comes to bedroom activities, they're not quite ready for the challenge. But it's not only acute alcohol intake that can cause issues in the bedroom, also chronic alcoholism can definitely cause erectile dysfunction as well. Okay, besties, we hope that you enjoyed this episode. And you know, we really want you to know that it's not that you're responsible for his health, not at all, but because you love him, you really do want to have a stake in his health. You know, we want our boos to be around, we want our husbands to be around, we want our dads and our brothers, you know, to live healthy lives as well. And if we can help them do that, why not?
So we'll see you next time. So be sure to check us out on Facebook.
BestiesMD, one word.
Or follow us on Twitter.
At BestiesMD.
Or Instagram, we're there too.
At BestiesMD.
And feel free to send those comments into us or suggestions for future topics you want us to talk about at wearebestiesmd@gmail.com. Check you out next time.